A lot of people who have had trauma from a parent, from a divorce, from a significant other, even as young children or young adults, it just perpetuates into other parts of their healthcare journey and things that I'm starting to ask them. You know, when you were a child, were there things that really caused trauma? Because it does perpetuate, and a lot of people who have an adverse childhood experience do have a substance use disorder because it numbs them and it takes them away from whatever the pain is of what's happening. But really, if you don't unravel that or help with that, then they're not going to be probably as successful in their healthcare journey as they would be if they're willing to engage in some counseling or other things to heal from that.
Yeah, I had showed you a picture that I was little, I was tiny, and the plants that I was sitting in between, those marijuana plants were much taller, you know what I mean? So it was a good comparison as far as like, hey, look at how big my plants are growing, right? And they were healthy, you know, Pops knew what he was doing. And so, I mean, I think that's a great example of how this lifestyle was kind of paved before I ever got to it.
I come from an alcoholic, drug addicted home, at least from one parent and family members, and so growing up, I thought that was something that I could avoid.
Growing up, I felt really alone. I didn't have many friends, and I didn't feel loved. I didn't feel safe or secure.
I didn't feel accepted. I didn't feel like people would like me for some reason.
When I drank that alcohol,
and I had that first drink,
the feeling I had, I felt important.
I could finally be myself.
I wasn't insecure, you know. I felt like I was a part of something.
I could finally speak to people and feel like, you know, the hot guy or whatever would like me.
I would get attention from boys at parties, you know, with the alcohol, and I didn't hold back.
The more I drank, the more I felt free.
Because I had decided at such a young age, I didn't think that me using this medication, even though it was prescribed to me in the beginning, using it for another reason other than pain was like a problem. And that was just delusion. I was delusional. I found something that made me feel really good, and I hadn't felt really good ever. And so I went with it.
When we think about whenever anyone has an urge to use a substance, it's typically related to either feeling pleasure or avoiding pain. So for folks that have experienced significant amounts of trauma of any kind, they got in a nasty car accident, they had a difficult childhood, dependent on the coping skills that they've been able to develop, dependent on the age in which they experience that trauma, the severity of that trauma, if it's not resolved, if it's just living inside their brain, just unprocessed and messy, they're going to have a lot of moments where they feel pain, fear, significant discomfort that substances in the moment can very adequately treat. So it is very true that if I feel like garbage, drugs make me feel better.